Hello there, ladies, and how are you doing today? I'm your host, Dr. T, on the Dare to Share podcast, and today I have a registered psychotherapist. Her name is Zenia, and she will be talking to us today. Zenia, I'd like you to just introduce yourself to the audience.
Hi, everyone. So, my name is Xenia Terrell. I'm a registered psychotherapist qualifying at the moment. And today I will be talking to you about narcissistic abuse and narcissistic personality disorder.
Thank you so much, Zenia. What we find is that the term narcissist, narcissistic disorder, narcissistic personality is used so loosely these days. So many people, someone upsets them, they go, oh, he's a narcissist or she's a narcissist. So I want us to really look at the scientific definition of this disorder, what the components are. So maybe we should start with just a really simple definition. What is narcissistic personality disorder?
Right. So I will start off, and thank you for pulling that out because narcissist or narcissistic abuse is a term that's loosely thrown around a lot. There's not a lot of awareness, but people are starting to know about what it is. Eventually, as we get into modern times, cultures and social structures are sort of asking people to talk more about it, speak up about the abuse, because it
Okay.
comes down to, does physical abuse only means that it's abuse? What about emotional abuse, mental abuse, any of those sort of subtle techniques that are used in narcissistic abuse? So thank you for pulling that out. The other thing that I would say is I personally believe that narcissistic abuse or narcissistic personality disorder is a spectrum disorder. So as all of us are humans, we do have these tendencies or tactics, strategies, whatever it is that narcissistic abusers use. They have either very little of them or too much of them. So
Mhm.
it's sort of a spectrum disorder. When it comes to narcissistic personality disorder, this person is has a personality disorder. It's more about them. A key
Mhm.
figure or paramount um, habits of narcissism is grandiosity or a high sense of self-importance, need for admiration, sense of entitlement without any achievement, their lack of empathy. That's a really big one, lack of empathy towards others. And their
Mhm.
exploitative behavior sometimes. So, need for what can I get best out of this, right? In terms of relationships or in terms of materialistic things. Another
Mhm.
really good one would be hypersensitivity to criticism. That sometimes gives it away too. So these are some of the 6 signs that people can use to see or judge narcissistic personality disorder or narcissistic abuse. The other thing that I did want to point out was narcissistic personality disorder and narcissistic abuse. They have a very fine line between them. NPD, which is narcissistic personality disorder, is more about the big I. All they see is themselves. Um, and the other person or other people are sort of minimized in that picture or perspective. Narcissistic abuse starts when that personality traits, all of these personality traits, are harming the other individual, either indirectly or directly. And that's when it becomes narcissistic abuse.
So, in summary, we know now that this narcissism or narcissistic personality is a spectrum. So that means some people may have all the 6 and manifest all of these symptoms that you're describing, lack of empathy, this grandiose feeling, sense of entitlement, and really, I call it a deep sense of just not caring about anybody else but themselves and looking out for what they can get. Now, is it possible, still on the spectrum, to have some people that maybe just manifest 2 or 3 of the symptoms? Does that still classify them as being narcissistic?
That's a really good question. And to point out, there's still a lot of research going around narcissism, narcissistic personality disorder, or narcissistic abuse. It's just in my personal opinion and my experience with clients, I have seen varying traits of narcissistic personality disorder. Some people have very little traits of them, but do we still classify them as narcissists? And some people have a lot of them. Are they like hyper narcissistic personality disorder, right? It's hard to tell. The more concerning part is how abusive is the abuse? What is the severity of the abuse? The personality disorder in itself is just the person being affected. But how is that affecting others in society or people who they live with, their relationships? So that's why, in my personal opinion, I say it's narcissistic. For example, some of the techniques that narcissists use very usually, normally, and see nothing wrong with it, is manipulation, gaslighting. Two of these, right?
Yeah.
Now, on a regular basis, a normal person would manipulate to a certain extent, maybe white lies, right? Or gaslight due to embarrassment. Or do we classify them as narcissist? So that's the reason why I say, like, maybe it is a spectrum disorder. We're all humans. Everybody do have some parts of those techniques that they use sometimes in situations, but it's very hard to diagnose narcissistic abuse and narcissistic personality disorder. However, there are assessments that people use to determine that.
Exactly. And I think these assessments really focus on those personality or those behaviors that you have mentioned earlier on today. I have a question which people ask me all the time. So let's now look at worst case scenario. So those that really manifest all the traits or most of the traits that we know, are these people born or are they made? So that means, are you just born narcissistic or is this something that develops over time? Do we have any research surrounding how people become that way? Extremely manipulative, lacking empathy, not caring about others but themselves. Are they made or are they just born? Is it a congenital problem?
I haven't come across research that says that, but that's a really good question. I would say it's both nature versus nurture. It comes down to that. You may have certain genetics that are passed down based on behavior, and also nurture, basically the child's environment. Were they abused or were they not appreciated when they were growing up in their childhood? What were their years like turning into adulthood, adolescence, all of those years? They count. What was their experience like? And similarly for the victims as well, why are they the victims of narcissistic abuse, right? And I did want to touch on that later on if you'd like, because they're used to that. They're familiar with that environment when they're growing up. They're familiar with taking orders or understanding that this is the norm and what the people tell me I have to do. I have to lose control. I have no decision-making skills, all of that. This is the baseline for them. This is the normal, which is why they are prey to narcissistic abuse.
Exactly. So still focusing on the narcissist here, I think we both agreed that it's probably multifactorial. There might be some genetic predisposition, but I think, and I'll say, like you said, the nurture perspective or the nurturing part of these children. I'm not sure about any studies I can quote off the top of my head, but I believe that most people that manifest the traits of a narcissistic personality are people that in their childhood they probably got everything they wanted. They were not questioned. They were allowed to, they didn't have to face punishment. They got what they wanted when they wanted it, and that kind of became the norm for them. We find in some environments that children that are born to narcissists tend to also act similarly because they've come to normalize that behavior as being okay. So we now to see what further research shows here, but we do know that these people with this personality or with this sort of behaviors exist. Now, going on to the abuse part, you were talking about those that end up being the victims, those that fall for the manipulation, that fall for the gas. You know, I think we kind of need to, because these people can also be extremely loving on the surface. We know people with narcissistic tendencies look out for empath. So let's kind of shift our focus to the group of people that tend to fall prey to people with narcissistic personalities. Tell us a little bit about those sort of people, whether they are women or men.
Sure. So just before we move on to that, I did want to point out that yes, you're absolutely right. And when it comes to a narcissist not taking accountability, and that's a big one for them, they're pampered, they're given everything, the entire entitlement, that's what really raises the narcissist as well, higher chances. Perfect. So shifting our focus to the victims. Yes, the abusers are looking for people who are empathetic. And when I say empathetic, it also means who have poor boundary setting skills. So the narcissists are very good with stepping over boundaries with such people, right? Victims are usually more empathetic. They're like, oh, I'm gonna let that slide, and that's okay. This is a friend, or we're just getting to know each other in a relationship, or it's a coworker, or it's my parent, the power dynamics, right? They play a really big role in that. And that's what gives the narcissist power to abuse the victim further and overstepping the boundaries, because each boundary that's overstepped, it pushes the person a little more into a corner kind of thing. If you visualize it, a visual representation of it, be trying to isolate them to a certain extent and cornering them eventually, that they don't have any other moves left or any other options left. So it is more about control and controlling that that person, that individual, or whoever the victim is eventually.
Right. And I think for narcissists as well, or people with narcissistic behaviors, once they find out that their victim, the empath, is starting to read them, is starting to understand them, is starting to not respond or react, and we're still going to talk about those strategies, they freeze. So really, let's talk about the self-worth of people with narcissistic personalities.
The self-worth.
Do they really have a self-esteem? I think they have an extremely low self-esteem.
That's a good question. And it really, to be honest, depends on the narcissist. Some of them have really high self-esteem. Some of them are not aware that they might have very low self-esteem, but they believe that they have a high self-esteem. So it really depends on them, right? And the way they are in the relationship or the dynamic with the victim. So when it comes to self-esteem, it's truly dependent on the individual and their personality, what they think. The abuse, it takes a different turn then.
Yes.
But when you say that when the victim starts to speak up about it or is aware of their techniques, two things that happen. Number one, the victim is less affected mentally. So mental wellness starts to improve, mental health starts to improve because they are aware of what techniques or strategies are being used against them. The constant state of confusion, the constant lacking of decision-making skills, being super flexible with whatever decision that you make or whatever it is, then I'm okay with it, right? All of that starts to reside. This causes the narcissist to lose control, to lose power. And that's when things start to go downhill. And that's when self-esteem comes in, like, this is really affecting me. These are the thoughts of the narcissist eventually. Why am I losing control? And that's the paramount key structure of narcissism. Cannot lose control over the empath or the victim.
Wow. So they must continue to get the control. And that's probably why it's very easy for them to move on. I don't know if you've heard about the discard phenomenon. So once they see the victim, they've been found out, as it were. I don't, maybe I should ask this question. Do they actually go into that relationship with a plan?
Do they go
Or,
into a relationship with a plan?
yes, or do they just want someone to keep putting up with their behaviors? What exactly? Are they like just people that plan to destroy their victims? It's a question.
It's a good question, and it's very dependent on the person.
Hmm.
I would say most likely not, because narcissists do not go into the relationship to destroy another person. I
Hmm.
personally don't believe that. It's
Yeah.
just a way of being. And if they don't have it their way, it's not happening, right? They have this sense of entitlement that whatever I say really goes. And if you don't listen to me,
Hmm.
you're in the wrong. I mean, I haven't done anything wrong. These are some of the thoughts that most narcissists would have. Um, and victims would feel, for example, a victim with strong boundaries would be like, I have freedom of speech. I have my freedom. I can choose whatever I want to do.
Hmm.
That's when the narcissist would be like, oh, this is a hard to control person. I'm going to let this go. But when over a period of time, they test waters.
Yeah.
Um, and when a person is in that stage, and right now I'm talking about relationships like partners, not
Of
parent
course.
child
Yes.
narcissism.
Hmm.
If they feel that a boundary is overstepped and the victim was okay with it, they ask for more the next time,
Hmm.
right?
Yes.
And the um whatever they're asking for it goes greater. So
Yes.
it's a bigger want or need later on. So more boundaries are overstepped, and the victim is just taught, quote unquote, taught to be flexible and lose control that way because
Yes.
they're in the practice. They're taught that. It's probably uh, the phenomena called classical conditioning.
Hmm.
They
Hmm.
condition them to take orders and lose control.
Can you please walk us through, in a relationship with a narcissist, the sort of emotions or possible emotions that the victims go through, starting from, the beginning of the relationship? Just walk us through some of these emotions, just so our audience can know. Because I know, being a survivor of a psychologically and very, very mentally abusive relationship, that you go through different stages of emotions. It's almost like you go from high to a state of confusion, to a state where you just wonder if you're going crazy, until you then make a decision. Walk us through some of those emotions.
It actually depends person to person of how the victim is, um, how resilient they are, how confident they are, what kind of social supports they have. This really determines how well they take the abuse.
Hmm.
For example, in the initial stages, when the victim is still going through some of these techniques that the narcissist used against them, for example, blame shifting, manipulation, gaslighting, you name it, and it's happening. Smear campaigning is another one that happens a little bit later on, but it initially starts with emotional dysregulation because if they are trying to have their word out and uh, it's not being heard, their emotions are not being heard or validated or acknowledged in any way. There is
Hmm.
emotional dysregulation. This kind of has a loop, it goes on to having other mental health concerns such as anxiety or depression, which are usually the ones, even stressors at work that kind of comorbids into something greater.
Hmm.
And that those feelings or emotions of not being heard out turns into something greater than than what it is. Emotional dysregulation actually gets bigger and gets into physical ailments. Sometimes they have
Wow.
like maybe skin conditions at times, which I've heard. Um,
Yeah.
some
High
of
blood pressure. I can
yeah,
say
like
high blood
physical
pressure.
aches and pains,
Yes, chest
constant
pain.
migraines,
Yeah.
leg pains. That's what I've heard with some clients,
Mm-hmm.
back pains. And this eventually is in their nervous system, it's stored as fight or flight and goes on to being in survival mode all the time because now they're into learning because they know eventually if they speak up, how the situation turns downhill.
Mm-hmm.
So because they want to avoid consequences, they want to avoid quote unquote punishments from the
Mm-hmm.
narcissistic abuser, they will avoid. They will know what to say, they will know what not to say to escalate the situation. So they will be very avoidant. Then they
Mm-hmm.
will be in confusion state when the narcissist gaslights them. They will think it was their fault. Yeah, maybe it was me.
Mm-hmm.
Yeah, I should not have overreacted, or self-blaming, guilt
Yeah.
tripping, some of
Mm-hmm.
those things. It just depends on how the person is and in what order. I'm just
Yeah.
throwing it out there.
Let's just throw out
It
the
might happen
different
in any
things
order,
that,
actually.
yeah.
Yeah.
Mm-hmm.
And then eventually, the person, if they are not very resilient, they really suffer from serious mental health issues, severe depression, severe anxiety, maybe schizophrenic. Uh, it just depends on what are some of the pre-existing conditions that they have too, and it may just exacerbate. Um, but these are some of the emotions or illnesses that actually come along for victims.
Exactly. So for the victims, it's more than just having to put up with this person's behavior. It's you may also develop physical ailments and mental ailments because people always just think it's just the mood of the house. It's much more than that. And I believe women need to know, and men, because oftentimes men are also victims, to know the impact of this sort of toxicity on their lives and on their health. And they just need to take note of that and make sure that they're taking good care of themselves. Now, if an individual finds themselves in an abusive relationship with somebody with a narcissistic personality or traits or behaviors, what can they do to protect themselves? What can they do to walk through this? Because I was sharing with you before we came on the podcast about my experience, about how bad it was and how I still wanted to stay in the relationship and how I started to use some of these tools. So can you please share a few of the tools that women or men in abusive relationships with narcissists, how can they keep their heads up? How can they cope? What sort of help should they seek? How can they manage, especially when they don't feel ready to leave the relationship? And the follow-up question to that is that do narcissists ever change? So let's start first with what people can do.
Yeah. For most of the relationships that are abusive, and especially narcissistic abuse, when there is no physical abuse, the victim is always confused. Is this even abuse, right? They're not sure. So the first thing that they can actually do is have strong social supports. Because the narcissist constantly tries to socially isolate them, so no one really knows what's going on.
Exactly.
Secrecy is a big one that they really depend on. Two types of secrecy: withholding information from the victim, so they will not disclose personal information or
Mm-hmm.
feelings or anything as such. And second one is their secrecy alliance. So anything that happens between us, you got to keep that between us.
Yeah. Don't tell anybody because they don't like you.
Absolutely.
I
So
don't think they're your friends. You can't trust them.
you can't trust them, like, and that's where it comes, where that's what the other part starts, is trauma bonding, right?
Mm-hmm.
It's an unhealthy type of attachment where the victim and the abuser are sort of in a relationship, and the victim normalizes that cycle of abuse. Because think about it, if a person is constantly bad to someone, they would know that, yes, he or she is bad. They're always bad. They're always abusing me. But when
Mm-hmm.
there is a cycle, right? Let's think of it as waves.
Yeah.
When they are really, really bad to you, you're at the bottom here, the bottom of the wave. Then they start love bombing you. Oh, I'm sorry, or try to apologize or make up for it in a certain way. You're in that high again, you forget about it,
Yeah.
right? And that constant up and down, that is toxic because
Mhm.
they're consistently inconsistent. And the victim is in the hope, after seeing that potential uh,
Mhm.
that they have of being nice. That
Mhm.
is being trauma bonded.
Exactly.
They are not able to make a decision, particularly because of this behavior and because they're in constant practice of giving their rights up, of giving their choices up, not taking decisions for themselves, and
Mhm.
social isolation. So, in these situations, it really depends on how the victim's upbringing is. Have they been have they been grown up in a childhood where they were supported by parents, good teachers, friends, healthy relationships who actually satisfy their needs or tell them how good they are,
Mhm.
validate their needs, right? The other thing is resilience. How resilient are they to such sort of abuse? Have they experienced something like this before? Are they aware
Mhm.
of it? So these kind of things really matter. And of course, as I always say, social supports, talking to an
Mhm.
external person so that there is a sort of baseline, what is
Mhm.
normal and what is below normal.
Exactly. Because I have a support group for women, and that have gone through abuse, narcissistic and otherwise. And when we sit down and talk about our experiences, it's almost like we're all reading from the same textbook. It's almost like, oh my God, and this happened to you, and this. So it's almost like there's a script that is played by these people. The isolation is a big one. And I believe that anybody that is in a relationship with you shouldn't make you lose yourself, shouldn't make you lose your social cycle. So, especially when the circle isn't hurting you or harming you, because it's a paradox, isn't it? They keep you away from people that can support you. Meanwhile, they pull you down with them.
Mhm,
They make your life miserable. And
mhm,
then they get you into this toxic cycle of highs and lows. And then they give you the silent treatment whenever you decide to speak up. So social connections are extremely important. And I would say that would be a red flag in any relationship. Any individual that wants to isolate you, you really need to reconsider that as an adult, somebody that's stopping you with oftentimes without reason or with reasons that are just made up. You just go, this person is bad, but they haven't done anything. So maybe sometimes as victims, we should also try and validate some of their assertions about other people when they really try to isolate us. What else can victims do apart from connecting with social networks?
Okay. So just on that point, I did want to say, and you brought up a really good point, social
Mm-hmm.
isolation. Why they do that is because they want the victims to be solely dependent on the abusers so they can turn and twist them the way they want, make them do whatever they want. And that's why they want the social isolation. Victims are truly just dependent on the abusers. Total lack of control. That's the reason why.
Mm-hmm.
Your other question, what was your question?
I was asking if they ever change and if there are other things that
Yes.
victims can do
Victims.
apart from social networks.
The other thing that victims can really do is gain awareness.
Mm,
Awareness is key. As long as they know what the narcissist is doing, um, their strategies really have no effect on them. Why I say that is, for example, trusting their experiences.
mm,
For example, a situation, whatever happened, and
mm,
the narcissist will gaslight and completely deny, no, this is not what happened. This is not what I meant. This is not how I tried to make you feel, or no, I did not talk to this person at all. Whatever the situation is, complete denial,
mm,
gaslighting the person. When the victim is unaware, they
mm.
will believe the narcissist and they will gaslight themselves, like
Wow.
guess themselves, right?
Mm,
Did this really happen? Self-doubt. Self-doubt is a really big
Second
one. It
guessing.
goes eventually, right? They're doubting their own experience. So one thing that I will really say to victims here, trust your experiences, trust how you felt. Those feelings were real. Even if the abuser or the narcissist tried to make you feel this intentionally, unintentionally, do something intentionally, unintentionally, whatever happened. The fact is that it happened and you felt what you felt. Trusting your experience. And number 2 would be awareness. Be aware of what they're doing. Smear campaigning is also another one that I usually talk in my groups. It's because
That's the big one, especially the later stages. They do that. I find that even friends that are close to you, they're so good at this smear campaign that they will turn your friends against you.
because
They'll
they have
make
to maintain that external persona, right? They do not let
absolutely
others doubt this behavior behind closed doors, and that's why this
exactly.
campaigning. Yeah, we won't get into too much details here. Of course, that happens at a later stage because when the narcissist really fears letting the real story out,
Exactly.
right? Yeah, lots of fun things to talk about.
I tell you, right? So
Your
do
other
they ever change? Do they ever
the
change?
ever change. I was just getting to that. My answer would be no.
Hmm.
They never really change.
Hmm.
The reason being, they don't believe there's anything wrong with them to get therapy. But
Exactly.
the thing is, I just did this, or I just said
Hmm.
that. And what was
Hmm.
the big deal to sort of blow the
Exactly.
rooftop apart? I mean, I'm a human being and victimization, self-victimization.
Yeah.
It's always that. Now, how can somebody improve themselves, attend therapy when there is
Hmm.
zero or negative self-awareness of what you did?
That's a big
Blame
problem.
shifting, manipulation,
Hmm.
gaslighting.
Hmm.
There's no motivation for change.
Hmm.
There's motivation for change if they see there's something wrong with them. But what if
Exactly.
they believe that there is nothing wrong with them and the victim is at fault all the time?
And all the time. So we can't help these
Common question
people.
I get too. Or
Uh-huh.
the other follow-up question, that's a common question I get in my groups. The
Uh-huh.
follow-up question is, what can I do to have a satisfying relationship with a narcissist? It could be a parent or a person, but I mean,
Yeah.
that's the thing. Like victims are craving closure. What do I do? They're
Hmm.
always sitting on the fence. They're always confused. Maybe
Hmm.
they have complicated situations, dynamics. Maybe there are children involved at
Hmm.
times. And in such situations, it is very difficult to make a
Hmm.
decision, especially when you're out of practice for making decisions, right?
Yeah.
Constant state of confusion. It is always best to trust your experience and know what is right for you.
Yes, yes. And I mean, I like the fact that you brought up this one about parents because sometimes narcissists are actually parents. Sometimes in these relationships, children are involved, and you still have to co-parent with this person. And I think, like you mentioned, awareness is a big one. And I also feel that narcissists they like to play these mind games with you. They like to really mess with your head,
Mhm.
but they need you to carry that out. So I think one of the strategies I used was to stop being a partner, to stop being a part of the drama, to stop being a part of the argument, the seeking attention. I just shut down. And I know that might be difficult, but sometimes maybe that helps me. I refuse to show emotions at some point. You want to hurt me, yeah, but I won't let it get to me. You want to ruin this dinner? I will still go ahead and have dinner, you know? And that would come from having a lot of awareness and maybe also therapy, learning about boundaries, learning how to put your foot down. Because I was in that relationship for over 5 years. And by the second year of the relationship, I knew something was very, very wrong. I couldn't put a finger on it, but I knew some. I just said, this is not right. But over time, after several years, I was able to put a name to it, and that really helped me. So I feel that people that are victims should also get help for themselves. Because if I knew how to really maintain firm boundaries, if I wasn't just looking at fixing this person, I probably would have saved myself 4 or 5 years of additional stress that I had to go through in that relationship.
Absolutely. I'm so sorry to hear that. But what you explained was actually part of Grey Rock method, which
Mm-hmm.
is reclaiming your power. And if they are being abusive, if they are escalating the situation, trying to stay calm in that,
Mm-hmm.
holding your power down, staying grounded, not being, because they try to emotionally destabilize you, make you panic with either yelling, screaming, throwing things around, all of that. And I see that smirk, which is the usual, I guess, the textbook.
I tell you.
But when you hold that power, when you're holding your ground in those panic situations, and you don't show fear or argue back, the gray rock method, they will come down back to your normalized, because they always mirror. They mirror
Mm-hmm.
reactions. You take a notch higher, they will take another notch higher.
Absolutely.
Right. And the other thing that I did want to point out was for the victims, basically, when they are growing up, when they're familiar with a parent who is a narcissist, they're more likely to attract partners who are narcissists because they're familiar with that upbringing. For example, a
Mm-hmm.
mom or a dad who is always telling them what to do, what not to do, never really validating their feelings. They know
Mm-hmm.
this is the norm. Oh yeah, mom was like that. That's fine, but she still loved me, right? And
Mm-hmm.
they are okay with the partners doing the same thing, treating them the same way until it goes far more worse or beyond repair.
Mm-hmm.
What's the other one? Yeah.
Thank you for that. Now, I know that there are questionnaires because sometimes people are just so confused. That, oh, is it really a
Mhm.
narcissistic personality or am I just being oversensitive? I know there are tools out there which are validated that people, victims can get and just answer the questions one by one. And they're so easy and they'll tell you whether or not you are with somebody with a narcissistic person. I don't know if you're able to research any of those tools, but I do know that there are a few tools out there that are available for victims. But sometimes it's confusing. They may feel, oh, am I just overreacting? So I believe just like when we screen for anxiety and depression, we have validated tools that we need. It might not always be diagnostic, but it might help you maybe talk to somebody, talk to a therapist, seek some help to know exactly what you're going through, you know. So I will try and find some and share it on this podcast so that women out there, men out there that feel that they might need a bit of screening to be sure whether they're crazy, whether it's in their head or whether it's really true, to know exactly where they stand.
There's one more thing that I did want to include here is
Sure.
I have, although we always say men being narcissistic, and because they are predominantly the ones
Yeah.
who are throwing out around this behavior. Research shows that 50 to 70% of narcissistic personality disorders or these traits are seen in men. Men are dominantly the narcissistic abusers, but there are also women who are. So
Yeah.
it is not only men.
Yes.
There are women narcissistic abusers, but in a very small number.
So that's really good. Again, we mentioned this at the beginning that it's not just a man thing. Men can also be victims
Yes,
of narcissistic and domestic abuse. I really
absolutely.
want to thank you so much, Zinnia, for today.
My pleasure.
Uh, do you have any final words for our audience just as we round up today?
My final words would be victims, be aware, learn about narcissistic abuse, try to know more about what it is, because it is not only physical abuse. That's when you say, oh, this is abuse. When you are stripped of your rights to speak, you're scared in a relationship, there's nothing to be scared of. Um, it's just a facade. It's basically training for you. Don't be scared, don't be nervous, and Don't be anxious. Learn about what are some of the techniques that are used. There are so many of them, and we can actually name them all for that reason. And the more awareness you have, the lesser effects they have on your health, physically and mentally. Learn from it. Test them out if you're living with a narcissist. See what works, see what does not work. Hold your ground. You are powerful. You hold the power to yourself and well-being, not others. You have control and you have your rights to make decisions. Okay? That's what my final words are.
Thank you so much, Nia, for joining us today, and thank you for your insightful conversation and advice for our women out there. And once again, I just want to thank you for being a part of this discussion today. And for the women and men out there, don't forget, hold on to your power. You are not going crazy, and don't let anybody isolate or abuse you. You are loved, you are beautiful. And until the next episode, hope to see you. Thank you so much. Thank you once again, Jenny. I appreciate it.
Thank you, Doctor.
Thank you. Thank you. Have a good night.